Hi guys, welcome to Cambridge A-Level Psychology. So make sure that this is the correct paper that you're taking is 9990. So A-Level, if you are taking the typical pathway to complete the A-Level Psychology course, so this should be the second year of you doing this course, where if you actually, I imagine you already done that, referring to the syllabus, yeah. So different from AS level, where you have to cover all the content of the syllabus in A level, you choose two specializations out of four possible options. Um, those will be the options that you need to answer in paper three and paper four. So basically, you can deep into, let's say, all the specialization if you really have interest to do so. But for the sake of just preparing for the exam, you just need to prepare for two, and that have to be consistent. Yeah, so you choose the two options. Let's say abnormal psychology and organizational psychology for paper three. You should be doing the same thing for paper four as well. And even though you, let's say if the question is actually in different sections, etc., you should not be choosing different option. Yeah. So yeah, just to try to be consistent. Now, of course, I imagine for some of you, choosing specialization might not be that clear, as you might be confused as to, okay, there are four, which one should I go for? Particularly, you might be thinking that, okay, out of four, which one would be the easiest if I actually need to take an exam? So, this is just my experience of teaching the paper and tutoring the paper. So, I will just give you some suggestions and recommendations. Then of course they are not necessarily correct, and it's just my experience of doing so. So you can, yeah, give me some feedback if I'm wrong, etc., or what you actually think about, or what is actually in your mind. You can just ask me. But try your best to actually answer your question. So I will begin talking about two specializations that typically institution would choose to let their student take. Yeah. So which is abnormal psychology as well as organizational psychology. This is particular case if you are doing A-level psychology in Malaysian's international school. Saying that, what it means is just that the teachers that are appointed to teach the course or paper will only go through the content for those two specialization. Doesn't actually stop you from choosing other specialization or prepare for it. Yeah. When I actually talk about the specialization, I will go into a bit more detail as to why this would be the case. Okay, so let me actually talk about the two specialization again. There is the typical choice by the institutions like international school first. Okay, so let's start with clinical psychology, which arguably I think would be the most popular among the four different specializations. Of course, clinical psychology from the term itself would actually let you know that this would be relevant to you if you are thinking about venturing into the career of becoming a clinical psychologist in the future. Yeah? Where the term itself, clinical, means that the clinical psychologists would be dealing with patients or people who are suffering from and need help in terms of mental disorders or conditions. More typically, when you go to university and actually take the course, it will be known as abnormal psychology first, rather than clinical. Clinical psychology will be referring to the specialization in terms of postgrad program after you complete your degree and then you get into like at least a master level, and then you would graduate as a clinical psychologist then. This would again suit those who are actually interested in finding more about mental disorder and trying to understand more about it. So for each of the specialization, there will be five chapters. We will not be going through the detail of the five chapters here, of course. Just to give you a brief idea for what would be involved in the content, this is something that you will be able to get a better idea of as well when you go through the syllabus. Yeah. So out of these five, in actuality, the four of them would be something that quite commonly studied by students, in the exception of number three, impulse control disorder. So we will have a chance to actually discuss why this is a bit weird, but it is kind of fascinating disorder nonetheless lah. So should be something that will interest you again if you're fancy is actually in this area particularly. So for today's video, we would more like to share about why clinical psychology is one of the popular topic, not only chosen by students but also by institution and teacher. Yet out of the four specialization, clinical psychology is arguably or actually the most structured one. Yeah? So out of all five chapters, they will have a consistency in terms of the content that they cover. So all chapters would involve a diagnostic criteria in regards to the target disorder. Of course, like for schizophrenia, you'll be talking about like the symptoms of schizophrenia, yeah, how to actually identify them, what would be something that is most concerning about them, and etc. And the most current syllabus would be following ICD-11, which is the diagnostic criteria that is applied by United Nations, yeah, instead of the DSM-5 that typically psychologists would use. But to be honest, not much difference in terms of the actual criteria, particularly the one that you want to get familiar with in order to actually do well with the paper. Yeah, so actually not much difference. So those of you who feel a bit confused if you have been exposed to DSM beforehand and now suddenly you want to talk about ICD 11 and etc., don't be worried. Symptoms basically the same. Yeah. So under diagnostic criteria, so typically for each of the chapter, they will introduce at least one psychometric measure, yeah, that is linked to how can you objectively measure the symptom severity of the particular disorder. For example, when you talk about mood disorder, it will be a measure that look at depression or depressive symptoms. When you talk about anxiety disorder, it will be about a measure that look at anxiety level. Yeah. So next will be explanation. Now, explanation means the theory that will try to explain the causes of this disorder, like where does it come from, and etc. So in general, it will be separated into two categories. You have the biological approach as well as the psychological approach. A biological approach would be covering more related to the nature side of the debate, where you will be learning about the genetic component regarding the like a particular disorder, yeah, what's the likelihood that it will be inherited, and etc. And you could be talking about abnormality in terms of physiological side, like brain abnormality, brain trauma, etc. That could be the causes of someone's disorder. Psychological approach would be where you learn about the causes that's not actually biological in nature, where it could be life experience, yeah, someone that experienced like extremely stressful event and all those things that could have caused the disorder itself. But physiologically, the person might be totally fine. Yeah, they are officially maybe just healthy. There's nothing wrong with them biologically. Yeah, it has to do with their psychological experience that actually caused the symptoms itself. So again, all five or each of the five disorder would cover both biological and psychological approach. Of course, under the two category, they are could be more subcategories. For example, psychological approach will touch on typically behaviorism or cognitive behaviorism or even psychodynamic. Yeah, in some cases, biological, as mentioned previously, could be talking about gene or physiological damages or trauma, etc. That could have lead to the disorder. Now, something that's closely linked to this is actually treatment. So treatment is also largely separated into two categories. You have your biological and you have your psychological. So biological treatment typically will be referring to drug. Um, in the exception of several cases where they would involve some more physical treatment, like the ECT, electroconvulsive therapy, where it actually involves shocking the patient's brain with electricity, yeah, in order to help them to relieve their symptoms. Although it might sound really scary right now, but actually is something that works, yeah, not 100% efficacy level, but it is a treatment that has been shown to be effective at some level. All right. So psychological approach would be more towards again the psychotherapy side. We will be touching on psychological treatment like behavioralism or CBT. So you might actually now hear that they are something really similar, right? Because they are quite similar. Again, treatment typically originated from the the explanation side. Yeah? So like biological approach would be corresponding to the biological treatment, and same thing with psychological explanation, yeah, will be corresponding to the psychological treatment. Now, again, why I say the clinical psychologist is the most structured out of four is that almost all chapter will follow this, meaning that you already know or expected what you need to study for when you go into the exam. Yeah. There's nothing surprising about it. Although the information definitely will be different, but you think about it like the idea of understanding how genetic is contributing to a particular psychological disorder or likelihood of someone having or being diagnosed with a psychological disorder, they are quite consistent. Yeah, same thing with the psychological approach, like the concept of theory of behaviorism is the same across all, although the actual mechanism of how it happens could be a bit different, but the general concept would be the similar one. All right. Clinical psychologist is also one of the specialization that have less information as well, which I guess is one of the reason why it's chosen by institution. Where yeah, again, teacher actually need to teach you less things, yeah, compared to the rest. Um, if you ask me, out of the four, in terms of content and structure, this would be the easiest to study for. Again, at the very least, you actually know that oh, these are the structure, these are the things that I can actually look at, or I should expect myself to know. So it serves as a really good checklist when you've gone through it. Um, the problem with this is that something that will cover later as well. If this is not something that you are interested in when you look at mental disorder, etc., it would not be an easy thing for you to study. But I imagine for most students, to be honest, you have some level of fascination with mental disorder. Like for a lot of students that I have a chance to work with or help and etc., they are somewhat fascinated by this. Again, it is a big part of psychology, whether one likes it or not. All right. So yeah, this would be the again the most popular option out of the four. If you do ask me, like if I do not have any particular interest, like anything would do, I just want to choose something that's easy to study for and would enable me to actually get a good mark in the exam, I would recommend clinical psychology to be one of the option. Yeah. Again, my experience that not only the content itself. To be honest, I'm not uh, I would not say that because the content is less, it's easier to study. It's not. It's more the structure nature of the content that make me think that it's easier to study and easier to prepare for exam for. Yeah. Those of you who want to confirm this, you can go and look at your syllabus or even go through the textbook, yeah, to check. But in general, this is the structure again. Although there will be a bit of differences, like what in each chapter, the emphasis could be put on different areas. So sometimes there are more information on treatment, sometimes there are more information on explanation, etc. All right. So that is for clinical psychology. Okay, next I will be talking about organizational psychology, which is again second most popular one, particularly among institution. So firstly, in general, organizational psychology is actually looking at factors that affects employees' performance, yeah, which of course would involve things from the employers themselves, like what your boss do actually affect how well you work, how well you perform, and etc. But to be honest, at the end of the day, it's about how can you squeeze more out of the workers. Yeah, but of course, you want to make sure that they're satisfied and happy. Again, if you just want to enslave someone and just push them as much as you can, they will not last long anyways. Yeah. So if you are intended to go into a management position in the future, this would be a area that you want to actually learn more about, particularly even let's say you want to start your own business, you know, where you learn about how to manage your employees better, but from a psychological perspective. and all these things actually have scientific evidence to back it up. Yeah, so it's a bit different from management perspective, where if you have learned about it from business etc., a lot of them are experience or like a principle or idea from someone who are really smart or successful businessman, but not all of them has been tested per se. But almost all the theories or ideas or concept in organizational psychology has to be tested and verified, given that psychology is a field of science. Okay, so again, if you are interested in this, you might want to venture into this particular area. If you still thinking about becoming a psychologist, this will be one of the field that is actually potential to make you quite a lot of money, and like yeah, comparing to clinical psychologists. Clinical psychologists do have a higher basic, like if you do completed the program and then starting your career, you do have a higher salary per se, but the limit can be quite low compared to organizational psychology, where it would we reach faster. Organizational psychology would, how well you do would largely depends on how good you are, of course lah. Yeah, if you are good enough where you work with a large company like the Fortune 500 etc., you will learn quite a lot. If you do your own research, yeah, even large company or multinational company in Malaysia, they have their in-house organizational psychologists or at least have an external consultant. For example, like Petronas definitely have one or two. Yeah, there's actually in-house and then serve as an external consultant. They actually earn quite a lot. Yeah, so that is the nature of organizational psychology. Again, same, it would have five chapters. Like if you actually look at this, it's all about work. Like although if we look at it, the motivation to work clearly is showing like how can you motivate people to work harder. Even when you look at topic like satisfaction at work, it is because more satisfied you are at your work, you are more likely to perform better, you're more likely to work harder, you are less likely to actually leave the organization. Yeah, actually saying that one of the things that you learn in this specialization is that why you, if you are a boss or management, why you should actually concern about absenteeism and people actually quitting quite a lot. It's never a good sign. Yeah. When people voluntarily quit their job and the quite high turnover rate is most clearly a sign that a business or an organization is actually failing. Now, returning to why this specialization is quite popular is that it is actually the shortest one. Now, if you actually look at your syllabus, of course, each chapter, regardless of the specialization, would have a key study. And then there will be other psychological concepts that will be mentioned, where they will bring in theories, yeah, to actually support it, relate to it, as well as studies, actual scientific research, yeah, experiments, your survey, etc., that is relevant to the concept and try to support it and basically give it more content lah. Organizational psychology specialization would be the one that have the least studies behind it. So you don't actually have that much experiment to remember and learn about. Now, that might sound like good news at first. Yeah, like, oh, actually, I don't like to remember all the details about studies and stuff. So, well, it would be a good thing that if I actually take this paper. The problem is that it doesn't actually have much content. Sounds like a good thing, but then it does means that it does not have a lot of detail and clearly defined stuff. It has much more theory compared to the other specialization. Um, one of the one that is really obvious would be the leadership one. Yeah, like chapter two, you actually look at it, it has a lot of theories. Now, issue with theories is that it tends to be something that's quite general, where it requires a deeper understanding in order for you to be able to remember it well, right? And with exception of few, I believe most of you who are actually taking A-level psychology have never been involved in business before. Some of you might not even have worked before, like even part-time job, full-time job, etc. So when we actually talk about the theories and etc., it might be something that's really hard for you to relate to, yeah. And uh, my experience as well as psychological evidence, yeah, do point towards the fact that or likelihood that if you cannot understand something, or the better you can understand something, the better you can remember something lah. If you cannot remember, you cannot understand it, like say a particular concept or theory, and you try to just do raw memory, you try to, yeah, just take the whole thing in like a photography machine or etc., you might be able to do well with the low mark short answer question in the exam, but you're not going to do well in the large one. Yeah, the describe one, the evaluation one, yeah, the design experiment one. Paper four, those you would not be able to do well. So that's where the concern lies. My recommendation for you is that if you are going to pick this, because yeah, again, if you are studying in international school, this is likely to be one of the things that you will be asked to do, or at least this will be one of the things that the teacher will teach you lah, but not the other two that we will talk about later. You do want to make sure that you are able to understand the concept quite well. If you do struggle with it, let's say you go through number one, number two, chapter one and two, when you found that you're struggling with understanding it, you try to remember the information and try to write out to answer more questions, etc. It doesn't seem to work. You cannot, yeah, actually remember anything. You tend to remember weak concept, etc., but not simply not able to put them into your head regardless of how many times you repeat them. I recommend you to actually consider the other two specialization instead of this one. Again, don't be tricked by the fact that it's actually the shortest chapter, and it seems to have the least empirical evidence and information to remember. It is not going to be an easy one, particularly again because my experience as students do have problem relating to it. Even when I talk about the example of workers, like how you can use this on workers, etc., they are unable to relate. Like most of them, again, like I say, never actually work a day before. So if this is you who don't actually have like at least some work experience, it would be quite hard for you to relate. Yeah. um, Even if you have a background, let's say you study business as well for your A level, it's not going to be something that really similar. Yeah, you can check the syllabus if you don't trust me. So just be aware of this. Like if someone actually tell you that I choose this because it's shortest one, it'll be easy to study, etc., not necessary. Yeah, again, particularly because of the number of theories that they actually involve, and sometimes the theory itself is not something that's necessarily straightforward. Yeah. So you just go through the material. Like if you're particularly good idea, if you already have textbooks, see whether the information is something that you are able to relate to. Yeah. If not, yeah, I would recommend you consider the other specialization and not simply, yeah, just go with this one. Yeah. So that would be organizational psychology. Before continuing on consumer psychology, it is worth mentioning again, you can see that other than abnormal psychology, clinical psychology, the other three specialization do not actually have a particular structure. Yeah, so yeah, you will actually check that quite easily when you go through the syllabus. It will just follow the key theme of the particular chapter, and basically just relate information that's relevant. And you The information can come like quite random, yeah, to be honest. Yeah, sometimes it doesn't even make sense, like why within this chapter you actually put this in, etc. So it can get quite weird. That's the again reason why I would say clinical psychology is the easiest one to study for, like if you do not actually have a particular interest, etc. Right? So let's continue on consumer psychology. Now, out of the four specialization, consumer psychology would be the most recent field that arise in psychology. It's something that's quite new, where people are starting to pay attention to psychology of consumer, how they make the decision, yeah, how you can manipulate the decision making in order to sell more product and makes people happy in the process, although they are spending money, etc. Previously, consumer behavior is a field of study under business and management. Yeah, so it's not really a psychological field. That's the reason why I mentioned that this only comes out recently, where consumerism basically become a inescapable part of our life already, where psychologists are starting taking notice, yeah, and want to study more and understand this more. And this, to be honest, out of the four specialization, if you can do quite well, this would be the one that earn the most money, like to my knowledge lah. Last time it would be organizational, but consumer psychologists nowadays actually can earn a lot. But again, you have to be good at it, all right? But even just simply studying this out of the four would be the one that student would be able to relate to the easiest. Yeah, because if I cannot like, yeah, you have spent money on buying something, like we are all consumer. It's not something that happens in your life, etc. So when you go through the material or the contents that's relevant to the specialization, you will notice that, oh, actually this happens to me as well. Oh, I can understand why this is. Oh, I actually have heard that as well. Oh, this one is something that uh, supermarket have tried to do to me and try to get me to spend more money, etc. This is especially a case with the new syllabus, and the first one, the old syllabus, to be honest, some of the topics quite old and it's quite weird to look at. Like for example, the old syllabus that there's one studies that talk about like how to set up casino and stuff. Probably not something that student would be interested in. But the new syllabus, yeah, it's actually do quite well, and again, my experience as student can relate to it quite well. Yeah, particularly one chapter later on where you talk about internet marketing and sort of digital marketing, right? So you would be learning about internal as well as external factors that actually affects consumer decision making. You know, internal means that people's behavior, own personalities, yeah, their living experience, their socio-economic status, yeah, something that comes with the person. External would be the external environment, something that the company would be able to actually manipulate. Like for example, making something trendy related to a particular celebrity, where if you're able to do it for some reason, people will spend a lot of money. Not sure whether some of you still remember that. The one that I always used previously was the Blackpink Oreo. Yeah, those of you who don't know can actually research that. So, yeah, really expensive Oreo cookie because it's associated with Blackpink. Same thing just happened like a few months ago, isn't it, on Pokemon again on Oreo. So the product itself does not actually change much. Someone who tried it actually say that the new flavor doesn't actually taste that good. But it's still more expensive and people actually want to get it. Like that is like part of consumer psychology. Of course, as you learn more, it's not that simple lah. Definitely, it's one of those things like how you can use association with something that people already like to actually sell the product, so that they will like your product by association. Like you like Blackpink, I associate my product with Blackpink, so now you like my product as well. Okay, so that's just one of them. So this would be the information that you will learn about. As you can see, in comparison to clinical psychology, seems actually quite random, yeah, and they are. Almost none of the information within this five chapter are repeating itself per se. Organizational psychology, there are still something that relevant, but to be honest, not really related anymore. All right, again, we can just simply treat it as like an isolated or independent chapter, or there's actually no link between them. um, Not sure whether you are able to understand it, but to be honest, when it comes to the time of studying, this will make it harder, given that you cannot make the relationship between them. As the better relationship you can make between information, the stronger it is, the easiest way for you to remember. Yeah, the more random information seems like a series of numbers and etc. would make it harder to actually remember. Yeah. Saying that again, my experience is that consumer psychology is one of the specializations that have a lot of content. Yeah, it is longer, particularly when you compare to organizational. Yeah, but my experience is that student can remember the information quite well. Particularly when it comes to application question, when it comes to evaluation, even if they are unable to remember the information or the content from textbook. Yeah, they are actually able to come up with something that are quite relevant and can be marked as a good point. Because again, it is something that happens to us as a consumer. So when you are able to actually apply the concept to understand our own behavior or behavior that we observe in our daily life, it makes it easier to just remember it, right? So you can give it a goal. If you do find that organization is not something that you can remember well, or even same thing for clinical, if it doesn't work out, don't try rote learning. I don't know whether you're good at it or not. If you are really good at rote learning, like you are one of those people who are known as the photocopier, you are able to reproduce information like word by word from a book, then yeah, then go ahead. You will be able to do quite well. Trust me, if you can remember the information, because like although it's not really something recommended by psychologists, which is irony. The way that they set the questions in A level is, yeah, largely by memorization. If you are able to remember the information that is like in the syllabus or in the textbook itself, you would be able to do quite well, right? But for people who are unable to do that, understanding and deep learning would be the key to go. Rote learning, yeah, trust me, would not actually help you that much unless seriously you can reproduce the whole thing word by word, like from a textbook. You remember the page number, this and that. And yeah, my experience is that the textbook is written in quite a weird way also. Like, it's better than the last one. The one that is written on the new syllabus is better than the last one. Is easier to read. It's much more organized already. But still saying that there are still some error. Not a lot. Yeah, seriously, not a lot. There's still some error, which means that I still recommend you to read the original article, particularly for the key studies. Yeah, okay. But you will find that it's actually quite a lot, even if it's just two specialization. All right. So that's consumer psychology. Again, the content quite a lot, quite big compared to particular organizational, but it seems like people can remember the information better. All right, don't just listen to me. You can go and have a read of the from textbook first and see how it goes. All right, then let's talk about the last one. So last specialization would be health psychology. Similar to consumer psychology, this is one of the recently uprising field in psychology here, where the concern of the focus now is not that we want to make sure that people are free of psychological disorder, which is the focus of clinical psychology. This is more looking at how can people live a full functioning life and satisfactory life and happy life, where they are not only free of physical and psychological disorder, they also actually have a life with good quality. Yeah, where you basically have a happy life lah. It's not simply that you have a life that you are surviving, you do not have diseases, this and that. Yeah, so this would be an area where you will learn about what are the factors that affects people behavior in this. Yeah, this one particularly suit people who want to go into the field of encouraging people to be healthy, to become health promotion, etc. Would be something that will helpful to you if you want to, if your dream is to become a doctor as well, where you would learn quite a bit about how to manage patients, yeah, so that they would listen to you, which is actually one of the topic. So this is the five topic. So number two would be the one adherence to medical advice, where you learn about what factors will affect whether a patient listen to you or not as a doctor. You will be surprised when you learn about the data, like how much patients and etc. don't like to listen to doctor. And in general, we learn about how to deal with pain, stress, and lastly, health promotion. Health promotion will be venturing into the area of policy making already, yeah, where you actually talk about, let's say you become a consultant of the government, how you can help the government to set up policy to encourage people to behave more healthily. For example, like how to get people to sleep early, drink more water, or last time most recent challenges or the COVID-19 pandemic, how they encourage people to actually take the vaccine. Yeah, so all those things would be in the health promotion. Then Similar to consumer psychology, health psychology is tend to have a longer content, more content as well. But if this is something that you are interested in, again, particularly if you're already aiming to become a doctor and stuff, this would be the specialization for you where you will be able to relate quite well. Yeah, it doesn't actually require any medical knowledge. It's not about that, so you don't need to know the drug lah, this and that to do this one well. This one is more, if it is has always been your dream to actually encourage people to be healthy, or I want to help people to be healthy again, like becoming a doctor and stuff, you will be able to relate to the concept that we actually talk about in this particular specialization. Yeah. And interestingly enough, this is also the least popular specialization out of the four. It's the one that least people choose lah. All right. Not that not many people want to be a doctor, of course they do. Yeah. But a lot of students found that it's really hard to relate to. Again, because think about it, this is a area where it's linked to doctors and like health policy maker. Yeah. So it's even harder than organizational psychology, where you relate to someone who just have working experience. Not necessarily that you need to choose this, but yeah, it depends on where you're interested in. Yeah, where do you really want to be? Like when you go into learn in the university and like go out, what is your target career, etc. Now, saying that, it comes to the last key point that I want to address. Yeah? Now, whatever specialization you choose, you do not need to report it. You do not need to report it to doctor. Your teacher. You do not need to report it to the A level. You just need to answer accordingly to the specialization that you've chosen when it comes to the exam time. Okay. Another questions I imagine you will ask is that whether uni cares. They will not know what specialization you choose. They will only know the marks that you have once you completed the exam lah. So saying that, yeah, might be a good idea to actually choose the one that would seemingly easier to study for exam, yeah, which in this case, firstly, definitely clinical psychology. Again, my own opinion experience, yeah. Organizational, as I mentioned, in terms of content is less, but yeah, when it comes to understanding, not really necessarily the easiest one to study for an exam. All right, something that you need to be aware of, yeah. So yeah, if you just want to go with the exam as only, I would still recommend that you choose the specialization based on your interest. Like what is the area that you really want to learn more about. This is something that when you read the textbook, it's not that you're reading the textbook to study, to memorize the information, to force yourself to put those things into your brain and stuff. You read it as if that this is the novel that you like, something that you really want to find out. When you read it, it seems really fascinating, etc. Then that would be the specialization that you want to go for. Because try to think about this, like how much easier is it for you to remember the information and revise the information when you are reading something that you really want to pay attention to and not just forced to pay attention to. It's something that you really want to understand, something that you will ask the teacher questions in class, yeah, because you want to find out more, not because you are concerned about the exam, etc. Now, it's not me who say this. Yeah, it's a psychological evidence pointing to that the interest actually plays a really big role in how well you can remember something, how well you can study, and how well you perform in the exam. It's all about interest. And I don't know how many of you really thinking about venturing into a career of psychology, but including me myself, the most common reason students give when they ask why you choose psychology, it doesn't seem to be an area that will allows you to choose or you have an easy career or earn a lot of money, etc. The answer is interest. Seriously. That's the reason why we come into this. That's the reason why we would endure it. I will tell you now, psychology is not necessarily the easiest thing to do in university. Yeah. Do not listen to people who tell you that it's easy. It's not. All right. Ask people. So students who are doing undergraduate, they will tell you, but it will be enjoyable if you actually like it. Yeah. So again, personal recommendation. You do not need to listen to this. Choose something that will interest you, something that you're happy to learn more, something that you feel like it's not a torture when you go through the textbook and the articles and the study and stuff. Don't worry too much about like let's say your interest actually in health psychology, but you find that the key study article is too hard to understand because there are a lot of jargons and etc. Now, helping you to learn and understand is the job of your teacher, not just simply you. All right, they should be the one who actually help you to understand it better, etc. So don't put that responsibility just on your own shoulder. Even saying that if you do not actually have a teacher and you're just doing this on your own, to be honest, if you are interested enough, should not be an issue for you to be able to understand it. All right. So if this actually end up on a YouTube channel, you put the comment, ask the question there, will answer you. Again, at the end, when it comes to it, my final recommendation is this: go and get your hand on textbook. Let it be electronic copy, let it be a physical copy. Go and read a bit on the information first. Don't just simply skim through. Particularly when it comes to the key study, identify in the syllabus. Yeah, try to read the information. Yeah, it will be in the new textbook. It will be like box and everything is really clear. See whether it's something that you really want to find out more. Is it something that when you read, it really fascinate you, you find it really interesting, etc. Yeah, then after you've gone through some information for the full specialization, don't then on you choose. And of course, if you do not have any particular interest in stuff, you can go with the one that your institution chosen for you lah, which likely will be clinical and organizational. Yeah. So I guess that's all for me. Looking forward to hearing from you guys and etc. as well. Um, so there's like a message after this as well. So just try to give it a bit of time to listen.